Welcome, doctors. Today, we're diving into the crucial process of Zepbound, tirzepatide, insurance eligibility and prior authorization. Whether you're prescribing this for obesity, type 2 diabetes, or obstructive sleep apnea, getting the insurance approval right is essential to ensure your patients get timely access to this life-changing medication. So, let's walk through the entire Zepbound prior authorization workflow step by step, just like Staffingly's virtual medical assistants would do behind the scenes to help you navigate the process with ease. Step 1. Confirming patient insurance. The first step is always checking if the patient's insurance is active. Log into your EMR or the clearinghouse portal, and verify the details. Make sure their insurance is up to date, they have pharmacy benefits, and there haven't been any recent coverage changes. If you find that the status is inactive or expired, reach out to the patient and confirm the details before moving forward. Step 2. Checking Zepbound coverage. Next, you need to make sure Zepbound is covered under the patient's plan. You can either call the insurer or check via their portal. Is Zepbound on the formulary? Is a prior authorization required? Do they have any step therapy rules? And importantly, check if the patient's plan excludes weight loss medications. If you find Zepbound isn't covered, it's important to know that upfront so you can explore alternative options or begin the appeal process. Step 3. Gathering clinical documentation. For Zepbound to be approved, insurers will require specific documentation. Start by gathering all the necessary ICD-10 codes, such as for morbid obesity or hypertension. Be sure to include detailed chart notes showing the weight, diagnosis, and previous treatments, along with any lifestyle modifications like diet or exercise. Also, if relevant, include current labs such as A1C for diabetic patients or TSH levels for thyroid checks. Step 4. Launching the prior authorization. Once you've gathered the necessary documents, it's time to submit the prior authorization. You have several ways to do this: through CoverMyMeds, which is the fastest and often integrated into your EMR system, or directly through the insurer's portal or even fax using their specific forms. When submitting, make sure to include the patient's demographics, insurance, and a summary of the previous therapies and medical necessity for Zepbound. Step 5. Tracking and following up. Now, it's time to track the progress of the PA. Most insurers will respond within 1 to 14 business days, but if you haven't heard back in 48 to 72 hours, it's important to follow up. Always document the PA reference number and set reminders for renewals. Keep in mind that most Zepbound PA will need to be renewed every 6 to 12 months, so it's crucial to track the expiry dates and stay on top of it. Why this matters? So why is all of this so important? Well, first and foremost, it ensures faster access to treatment for your patients. No more frustrating delays at the pharmacy. For providers, it reduces administrative overhead and minimizes those denial rates. And for virtual medical assistants, VMAs, this streamlined workflow means fewer escalations and a smoother process overall. What did we learn? Managing Zepbound's insurance and prior authorization process can feel like a project on its own, but when done right, and keeps the treatment journey on track. At Staffingly, our VMAs follow this exact method, combining payer calls, EMR tasks, and portal logins, always ensuring the process is thorough. And if Zepbound is excluded? We don't stop there, we escalate, appeal, and get creative to ensure the patient still gets the care they need. So, doctors, there you have it. A step-by-step breakdown of the Zepbound insurance and prior authorization process. By following these steps, you can ensure your patients start their treatment on time and avoid the common pitfalls that lead to delays or denials. Thanks for watching.